How do we prevent slash treat osteoporosis? And the good thing is, as we mentioned earlier in the podcast, is there are so many different things that you can do to actually decrease the chances and basically improve the likelihood that you won't get it. So we're talking about controllable items. Earlier in the podcast, we talked about genetic and all these different components that you can't really do anything about. Some of these hormonal changes are just part of age, right? When you get older, you're at an increased risk. So these next portions are controllable items, and they have a huge, profound difference on the chances of you developing osteoporosis. So make sure you pay attention. Okay, the first thing is diet. So this is something that's like shocker, having a healthy diet, high in fruits and vegetables, decent in overall calories, high in all these vitamins and minerals we know are good for us, is going to decrease the chances of us getting osteoporosis. Fruits and veggies have a bunch of different things in them, like minerals and nutrients, which help to offset osteoporosis. Something else, though, as I mentioned too, osteoporosis is usually a disease of not having enough calories, as in you can't have your body can't hold itself as when it comes to body weight, right? So if you don't eat enough calories, you're going to be very, very underweight. And usually individuals who have osteoporosis aren't eating enough food. They're very underweight. Their bones are now taking the minerals and potentially a little bit of that protein to use it in the rest of the body functions, and that's not a good thing. So making sure you're getting substantial calories. I don't want you to overeat and become overweight, as we discussed. That's not. But getting the proper amount of calories for yourself is key. Foods that are high in calcium. Calcium is one of those often talked about nutrients. Specifically, it's a mineral that your body needs, and it comes in different forms. Some of them are dairy, cheese, yogurt, sour beans, leafy greens, and almonds. So those last two are kind of some ideas if you're vegetarian or vegan, how you can get some calcium in your diet. I actually thought it was pretty neat that leafy greens had a decent amount of calcium in them, because you often hear people drink, oh, get your glass of milk for calcium, and that's true. It'll get a decent portion of calcium for the day, but you can also eat some, spinach, leafy greens, these things too. Stuff that's high in vitamin D when it comes to your diet will help to reduce the chances of osteoporosis. Vitamin D from the sun. This is something I haven't talked about a lot, actually at all yet in this podcast, I don't believe, but you can actually get vitamin D from the sun. And what happens is when you get sunlight, your skin actually takes in provitamin D from the UVB rays. And what happens in your body is that vitamin D can be converted to pre-vitamin D, which is the vitamin D we use to help with the absorption of calcium. During the summertime, pretty much anyone gets enough of it if you go outside for even 10 to 15 minutes of the day. During the winter time, if you are, I can't remember the exact coordinate, but basically if you are in the Western Hemisphere, in the northern section, so above the equator, during the winter time, the sun isn't as intense, sun isn't out quite as long, so you won't be able to get quite as much vitamin D, or actually the necessary values of vitamin D from sunlight. So you need to be making sure you are eating it through your diet. Your doctor may recommend a supplement. I would talk to them about that when you're going and getting your osteoporosis tests and treatments, and just kind of discussing your options. If you are at that high-risk category, a doctor may recommend a supplement for you. Otherwise, you can get it through fish, eggs, yolks, liver, and fortified foods. One thing you'll often see is orange juice has vitamin D fortified to it. And this is just a way to potentially get you to increase your overall vitamin D consumption. There's also a lot of cereals that have it too. And the last thing that's usually lacking in people with osteoporosis is protein. So making sure you're getting stuff high in protein. For you who do eat meat, chicken, beef, fish, eggs, and dairy, that would be a vegetarian source. Otherwise, when it comes to other ways you can get in protein through veggie sources. There's whole grains, beans, tofu. This would be a little bit tougher for you to get those protein sources in. So if you are vegan or vegetarian, make sure, I would actually recommend to get a supplement. So like maybe a pea protein supplement or some type of supplemental powder that's vegan for yourself, because it's usually very hard to get protein. And also it's very hard to usually get calories in some of these vegan and vegetarian diets, specifically vegan diets if you're following very, very strict vegan diets. So just something to consider. You might need a supplement. And again, if you are enjoying this video, if you're finding value from it, please consider liking. I greatly appreciate it. And the next part is lifestyle intervention. So that was kind of diet. Now we're moving into lifestyle. So one of the biggest things is smoking related. As we talked about earlier, kind of the mechanism with smoking isn't fully sussed out, but we do know that if you do smoke or even are exposed to secondhand smoke, this can actually increase the chances of getting osteoporosis. And thankfully nowadays in the 21st century, smoking is kind of something of the past. It's not really getting talked about or even done nearly as much. Vaping is kind of the new thing, which is kind of a whole catch-22 of all their potential issues, but smoking's going way down, so hopefully this isn't as much of a spread or message to others, but smoking, bring that down. Alcohol, drink moderately. If you are a female, that means 1 drink per day is considered moderate. Males, 2 drinks per day. I personally think that if you can cut alcohol out of your diet completely, that'd be a great idea, because alcohol is not something you need. And if you can manage your stress, if you can reduce your anxiety and do all these things without the use of alcohol, the potential dangers from alcohol if you start drinking are exponentially high. And maybe a social setting, it's sort of good, but I can't find any reason that somebody would need to drink alcohol, right? Like there's nothing that really benefits you inherently. If you want to, that's okay. Feel free to, but a lot of the data with brain health, especially nowadays, is not good when it comes to alcohol. Another big lifestyle thing, and this comes to your health in general, is getting frequent checkups. So if you're somebody who is high risk for developing osteoporosis, I'd highly recommend getting frequent checkups in addition to your other blood work stuff. So, potentially elderly individuals are probably going to get different blood work tests. Maybe if you are somebody who just stumbling on words, just got done with having cancer treatment, you're at a higher risk. So I would recommend maybe getting checkups specifically osteoporosis related. If you are a female in that high risk category, if you are somebody who's very underweight, knowing your risk category and it is something you should really concern about makes this key. If you are high risk, getting those frequent checkups. And also you can ask them about anything that will affect your bone health in addition to this. I've hopefully given you quite a few good ideas and some knowledge, but at the end of the day, I'm not everyone, and everyone's got a different perspective on this, especially doctors. So get second opinions, get some more advice as well. The next portion of this is exercise. And exercise is probably, in addition to nutrition and diet, is one of the biggest levers you can pull to actually decrease the chances of you developing osteoporosis. And when it comes to exercise, your early childhood and adulthood, is one of the best times for you to develop bone mineral density. And we talked about this earlier, that peak bone mineral density between 25 and 30 years old, roughly, is when we can literally build so much of it. So we honestly have a little bit of extra reserve as we go down in age, as we get older, of course. Consistent activity is the key. So running and jumping, specifically high impact activities where you're placing a lots of load very quickly, very rapidly on the ground, is going to improve your bone mineral density. It's going to tell those osteoblasts to help build bone. With that said, if you have osteoporosis, it's probably not a good idea to do high impact activities because you're at a greater risk for a fracture. So doing high impact activities, assuming it's not painful and it doesn't hurt you, is a great way to hopefully stave off that osteoporosis. But if you have osteoporosis, probably good to do some of these other activities such as resistance training. Resistance training is one of the biggest levers you can pull, and this could be something like free weights, it could be exercise classes, it could be low impact exercise classes. It doesn't matter, just putting stress and weight on your bone, anything that is weight bearing and puts a little bit of extra load on your bone is going to essentially build your bones. So don't overthink it. Anything is good. Even just picking up objects around the house, doing wheelbarrowing, with different gardening activities outside, moving stuff outside, all these things are putting stress and demands on your body, which get you stronger. Speaking about getting stronger, a good proxy you can use of, if your bone health is good is how strong your body is. If you have a strong body, your bones or the muscles, your body is literally connected to the bone. So you can't really have for the most part, a strong muscle without a strong bone. So just know that if you're working your muscles through stuff like resistance training, your bones are going to actually be improved in strength as well. I've mentioned resistance training like 5 times in the last minute. Just know it's important. But even stuff beyond that, walking is a great activity. It is much lower impact than per se running or jumping, but walking still does place some direct contact on the bones, gives it a little bit of activity, and it's weight bearing. That's one of the big keys. And beyond osteoporosis, all these different things with exercise, I just feel like I have to mention as a health professional, your heart health improves, muscular health, joints, brain, blood sugar regulation, all these things will holistically help us to be healthier is so crucial. If you want one pill or one medicine you can do the rest of your life that will basically get rid of 80 to 90% of the diseases, exercise frequently. So crucial. Find something you enjoy. It doesn't have to be crazy. The last thing of how you can treat osteoporosis, and this isn't within my realm of practice, so I'm just going to touch it, is medication. There are some medications that you can use that your doctor may prescribe you that could actually help to increase the chances of your bones getting stronger and decrease osteoporosis from having. And this is kind of like vitamin D supplementation too. Just something you consider and should talk to your doctor about.